My name is Fadhil Geriga. I'm a child cancer and blood specialist, and I work at the Uganda Cancer Institute. Just like adults, children also do suffer cancer. Some of the cancer children suffer are more specific for children, but others are also do exist among adults. The example that I can give is the cancer of the eye, which is called retinoblastoma, is specifically a cancer of children. But again, children can also get cancers that adults get, especially cancers of the blood, which are called chronic myeloid leukemias. Just like as you're aware, any part of the body can become cancerous, ranging from the skin to muscles, to the eye, to brain, to bone, to kidneys, to liver, to eggs, that is ovary and the testes, and brain, all can suffer cancerous, including blood. The specific cause of cancer general is not known, and more so in children. Why children get cancer is typical by bad luck, and there's no clear scientific explanation as to why children get cancers. We do know that among adults, there are a lot of environmental factors that are known to predispose somebody to cancers. But because children have a very short life on Earth, they have not been exposed a lot to the environment. Therefore, their environmental risk to cause cancers are actually very, very low. And that's why the typical cause of cancers in children are actually not known. Just like what I mentioned on, children can have various types of cancers, but specifically, the WHO, through its GICC, has identified some 6 key cancers in children that should be a priority because they are common, and 2, they are easy to diagnose and also easy to treat. And therefore, WHO thinks that if we prioritize these 6 cancers, then we can actually improve survival of children's cancer. Among them is a cancer of the blood called acute lymphoblastic leukemia. The next is a cancer of the kidneys called nephroblastoma. Then we have cancer of the eye called retinoblastoma. Then we have cancer of the lymph nodes called Hodgkin's lymphoma. Another cancer of lymph nodes also called Burkitt lymphoma. And finally, a cancer of the brain called low-grade glioma. These 6 cancers have been identified by WHO to be the commonest and easy to treat cancers, and therefore should be prioritized if we are to get them cured. Generally speaking, children cancers are highly curable compared to the adult cancers. They are treated and can be cured using 3 modalities. One is the use of chemotherapy. These are drugs. They can be either swallowed capsules or tablets or injection that a patient can get for a specified period of time for a particular cancer, and they get cured. Additionally, some of the cancer children can also be treated using surgery where the affected part is cut off. One example I can talk about is cancer of the bone, where a limb has to be cut off, or cancer of the eye, where the eye has to be removed to achieve cure. The third treatment option for treating cancer in children is the use of radiotherapy. Radiotherapy is a strong form of an X-ray that sends light that goes to destroy the cancerous cells in the body. So these 3 options of treatment of cancer in children, including chemotherapy, including surgery, including radiotherapy, can be used alone or can be used in combination to achieve cure for children with cancers. When a child has gone through cancer treatment, there are always 2 possible outcomes at the end of it all. One outcome is that you get cured and therefore has to be rehabilitated and go back to the community to live a normal life. And that, of course, the other option is that your cancer is an advanced or it's a bad type, and then it costs your life, and then you go through what we call palliation just to control symptoms. Now, just because the real cause of cancers in any population are not known, once you are being cured of cancer, you still have the same chance that you can actually get another cancer later in life. And that's why, as a principle, when we treat children with cancer, we do not completely discharge them from follow-up. We have to follow up them for several years to be able to look for possibility of them getting cancer again. And in case it happens, then we should be able to identify it early and give them treatment to get them cured. Children cancers present like most common children illnesses. The example I want to give here is cancer of the blood, which mainly presents with high body temperatures and lack of blood. Other cancer in children can present with swelling, which can be in the thigh, in the abdomen, in the neck, in any part of the body. Or children can also get, especially when they have cancer in the brain, that can present with headache, convulsions, and difficulty in good vision. Now, when a child has any of these symptoms, this child should be timely and appropriately screened and be able to be tested for the appropriate cancer. And if the cancer is diagnosed then the child can be referred to the appropriate treatment center. For today, we only have treatment center in Kampala, in Mulago, we have another treatment center in Barara. But I'm quite aware in the near future, we are going to have treatment center in Arua, treatment center in Gulu, and treatment center in Mbale. So the country will be served with 5 treatment centers in Kampala, Barara, Gulu, and Mbale. Children cancers can be not screened for, as I mentioned earlier on, but early intervention is based on quick recognition of the symptoms that I mentioned, that if a child has fever and has lack of blood, it could be malaria, but can also be cancer. Such a child should be screened for cancer appropriately. If a child is having convulsions and is having difficulty in vision, seeing well, the child could be having epilepsy, but could also be having cancer in the brain. If a child is having bone pain, pain in the leg, it could be that maybe it is because the child fell off a bicycle, but can actually be cancer of the bone. So what I'm saying is that any symptom a child has can be cancer, and therefore people should stop off-counter medications, should have an assessment by qualified health workers to be able to see if what the child has could be a sign of a cancer or not. Thank you.